Welcome, everyone. It is so exciting to see over 150 people have already logged in to a presentation called Legal, Housing Protections, and Property Management Models for Survivors in Permanent Supportive Housing. My name is Amy Turk. I'm the CEO of Downtown Women's Center located in Los Angeles. We are recording this session so that we could share it out with people who could not attend today. And I also want to point out that we do have closed captioning if you hit the live transcript button at the bottom of the screen. Welcome. We're here today because for a number of reasons. Downtown Women's Center is here because we provide a full continuum of services for women experiencing homelessness. For over 40 years, we've been providing permanent supportive housing for survivors of trauma, namely of domestic violence. Also, back in 2016, along with a renowned domestic violence service organization in the Los Angeles area, Rainbow Services, Downtown Women's Center created the Los Angeles Domestic Violence Homeless Services Coalition. In our coalition of survivors, homeless services, domestic violence organizations, government employees, researchers, and philanthropic supporters, we have been striving to build out a full continuum of housing resources for survivors at the intersection of domestic violence and homelessness. And as a sector, we know a lot about how to provide emergency and transitional housing for domestic violence survivors. And thankfully, our field has grown tremendously in providing permanent housing through rapid rehousing models or the domestic violence housing first model approach. But little is actually known about creating and utilizing permanent supportive housing as one housing intervention for individuals and families at this intersection. So we partnered with the National Alliance for Safe Housing and Corporation for Supportive Housing, and we wrote a toolkit. For the first time ever, this toolkit, we'll link it in the chat soon. For the first time ever, it incorporates a unique perspective from survivors, as well as architects, service providers, property managers, and housing developers. We launched the toolkit earlier this year, and we heard from the audience that attended the topics that they wanted to dive deeper in. And that's what brings us here today. Today's conversation is a deeper dive into Chapter 11 related to property management and Chapter 14 related to housing protections for survivors of domestic violence. And in our time together today, we will provide an overview of key federal, state, and local housing protections that apply to survivors in permanent supportive housing, and examples of practical applications of these housing rights, particularly as it relates to the property management role. And now it's my pleasure to introduce Saba Mawini, one of my favorite colleagues in this work, a senior program manager at Corporation for Supportive Housing. Thanks for being here, Saba.
Thank you, Amy, for that beautiful introduction. And welcome everyone to our time together today. My name is Saba Mawini. I am with the Corporation for Supportive Housing, and it's my pleasure to be your co-facilitator today, along with my colleague, Suzanne Marcus, and fellow co-creator. Hi, Suzanne. And so we are really excited about the panel that we have, some amazing, talented and heart-centered people in this work, and with varied roles and perspectives, resident, legal, continuum of care, supportive services, property management. And so we're gonna be excited to jump right into our intros in a second, but I just wanted to offer us a space together to ground ourselves a little bit first as a community, a virtual community, as you will. And so let's just take a quick moment to, if you're able to be sitting and you're able to close your eyes, to go ahead and ground your feet or ground yourself on the floor, and with the surface beneath you, your chair, the floor, and then go ahead and find the natural poise of your spine. And if you can, close your eyes and point your eyes up to the space in between your eyebrows for a moment. And we're just going to take a second in meditation with each other or mindfulness. Go ahead and notice your breathing. And if you have thoughts, just imagine them like clouds passing in the sky. If you find any tension in your body, go ahead and relax it. And then let's all together take some breaths together. Let's go for 3. And so whenever you're ready, go ahead and take an inhale and exhale. And inhale again. And exhale with sound. A little movement if you want. And go ahead and inhale. And exhale with sound and movement. Okay, so thank you for that. And just notice how you're feeling in your body now. Okay. I hope everyone's in feeling well and in good health, and so much gratitude for our togetherness on this call. And I'd like to start with intros of our amazing panelists. And so I'm going to invite the panelists to go ahead and come into the virtual space. And so if you would start with just share your name, your pronouns, and 1 to 2 sentences about what brought you to this work. And what we can do is one of us can go and then pass the virtual baton to another one of us. And so I guess I will ask Brenda maybe to start first. Thank you, Brenda.
Thanks, Saba. So I'm Brenda Tong. I'm the Deputy Executive Director for New Destiny in New York City. What brought me to this work? I am a social worker by training and my background. And what I realized was very quickly that it was very hard for anyone to move on in their lives or progress if you don't have a place to lay your head at night. And no more evident than knowing that we have a ton of children growing up in this city who are in those circumstances. So that's why I'm here with New Destiny. I'm going to pass it over to Christina.
Thanks, Brenda. Hi, everybody. My name is Cristina Cortez. My pronouns are she, hers, and I am with the Los Angeles Homeless Services Authority. And I came to the work because of the evolving needs that survivors have. I think Amy mentioned earlier, housing and DV, I think are not quite new, but still at the forefront of the work. And it just felt like something that we could do and can continue to address. And I'm going to pass it over to Carlo.
Hey everyone, I'm Carlo Ng, pronoun she, her, hers. I'm the Director of Legal Initiatives at the National Alliance for Safe Housing. So I'm an immigrant who grew up in public housing. That's a big reason why I started my career and spent quite a while and continue to do a lot of work related to housing assistance for families, especially for folks who have historically been at the margins in our country. So I'm really happy to be here today, and I will turn it over to Anita.
Hi, everyone. My name's Anita. I'm actually here as technical support from the Downtown Women's Center. I'm so happy to pass it along to another panelist, but thank you.
Oh, sorry about that. You can pass it
No.
on to whoever.
No problem. I'll pass it on to Sharik.
Hi everyone, my name is Sharik Byron. I'm a DV survivor and a resident of New Destiny. I'm also an immigrant and a student at the Hostess Community College. And yeah, the reason I'm here because I want to be an advocate. I want to be that voice to help other survivors know that there is always opportunities and other ways in which they could find housing, because it's the most difficult task as a survivor to find housing and to get financially stable and economically stable. Yeah. I pass it on to Amy.
Thanks, Sharik. I get to just conclude our panel, so you won't get to hear me yammering on today, but happy to be here from Downtown Women's Center, come to this work with a deep passion for making sure that our survivors have access to housing.
Wonderful. Thank you, everyone, for providing us, sharing about your story and your how you come into this work. I think for me, it's similar. I also have the immigrant experience, which kind of brought me into understanding how systems don't work as they should, and got me involved with wanting to be a part of that, especially with housing, because it's so fundamental. And I guess I'll pass it to Susan. I think we have a minute, Susan, so you can share too on that name, pronouns, and what brought you to the work.
Great, thanks. My name is Suzanne Marcus. I'm with the National Alliance for Safe Housing. I think what brought me to the work, or what's kept me in the work now for over 2 decades, is really just my very first experience as a hotline volunteer in a shelter, and the transformative impact that housing has on people, not just the people who are there, but the people who are like actually receiving the housing, but those who work there. And I think that actually directly relates to what we're talking about today in terms of property management and all the folks involved with developing and maintaining housing programs, because it's just as important for those folks to be engaged and grounded in trauma-informed practice as it is for the folks who are receiving those programs or receiving those services in housing to have a trauma-informed experience there. And with that, Saba, I could just move it to our first speaker. Does that sound right? Okay.
Yeah, you're spot on.
Great. I just have to note, there are 244 participants on the webinar right now. And that just amazes me, given the title, which is Legal Protections and Property Management Models. I'm just thrilled to know that this is an exciting topic for as many people out there as it is for me. And I think it's really indicative of just how interested people are in really looking at all the different elements of permanent housing for survivors. So I'm just so thrilled. And with that, I want to pass it over to my colleague, Carlo Ng, who's going to share the legal protections that survivors are afforded in housing. She will go over not just the Violence Against Women Act, but protections that survivors are afforded under other federal legislation, as well as existing new COVID-19 related protections. So with that, Carlo, I will give you the floor.
So much, Suzanne. So as Suzanne mentioned, we are going to talk about housing protections that apply to survivors. Because of our limited time together, it is going to be a fairly high level overview, and I'm sure most folks on the call will have lots of questions, in particular specific scenarios or situations that they have with specific clients or survivors that they have. And so instead of entering, potentially any kind of private or confidential information into the chat, we really welcome folks to go ahead and follow up with us. So we have I think our contact information is on the slides. And so you can go ahead and contact us, and we're happy to follow up with you and really talk through, what strategies or best practices that you could employ to really figure out the situations you're dealing with. So Jenny, if you could pull up the slides that we have for this session, that would be great. And then we can go ahead and get started with the overview of the housing protections. Okay, next slide, please. All right. So in terms of housing protections for survivors, there are actually many different sources of legal authority that folks can look at, but the ones that I'm going to focus on today are really the main sources that many advocates and survivors look towards when they're thinking, what kinds of housing protections or housing laws apply to survivors? So today we'll talk about the Fair Housing Act, which is a federal law, the Violence Against Women Act, which is another federal law, and then I'm going to provide sort of a general description of state and local laws because this is a national webinar and it's not specific to one particular state or locality. I can't talk about a certain state or locality, but I'll sort of generally talk about characteristics of some of these protections across states and localities. Next slide. So starting off, we're going to talk about the Fair Housing Act. So the Fair Housing Act is a federal law that protects domestic violence survivors from discrimination in housing situations. And these housing protections apply regardless of whether or not the housing is subsidized by the government. So basically, anyone in any kind of rental housing, if you're a homeowner, there are some protections that also apply to homeowners and housing transactions generally. Those all fall under the Fair Housing Act's protections. That piece is critical to keep in mind because when we talk about other laws like the Violence Against Women Act, the Violence Against Women Act only applies in situations where there's some kind of federal subsidy involved. So whether we're talking about public housing, the Section 8 program, it has to involve some kind of federal housing subsidy in order for the Violence Against Women Act's protections to apply. But in this case, with the Fair Housing Act, it applies across the board, regardless of whether there's a subsidy. Next slide. So under the Fair Housing Act, that's what FHA stands for, the rights that survivors have include to be free from discrimination when they are looking for housing or they're looking to buy or to rent housing. They are protected from eviction. They cannot be evicted because of the fact that they are survivors or they have experienced domestic violence or other kinds of intimate partner violence. They have to be treated the same as other tenants or other occupants by the housing provider, so say a landlord or owner. The landlord and owner cannot treat survivors differently than other tenants that essentially experience similar circumstances. A really common example that comes up in the context of property damage. For example, so say a survivor experiences property damage because of domestic violence and they go to the landlord and say, hey, I have all these things. And the landlord says, well, you have to pay for all this damage that happened because of domestic violence. But then in another apartment where they have a tenant that had experienced a break-in by someone they didn't know anything about the person who broke in, the landlord says, oh, it's not your fault, so you don't have to pay for anything. That is not allowed by the Fair Housing Act. The survivor can also request a reasonable accommodation to make sure that if the survivor has a disability, that they have an equal opportunity to use and enjoy the housing just as someone else who is able-bodied or does not have a disability. Next slide. So now we're going to jump into the Violence Against Women Act, which I mentioned before. So one big distinction between fair housing protections and the Violence Against Women Act's housing protections is that, again, the Violence Against Women Act only applies in situations where there's some kind of federal housing subsidy involved. So the Violence Against Women Act would not apply in situations where you have your sort of the run-of-the-mill regular market rate housing unless that market rate housing unit also has some kind of federal subsidy that is assisting the unit. So for example, a housing choice voucher, if that unit is taking a housing choice voucher subsidies or quote unquote Section 8, then the Violence Against Women Act would apply, but otherwise it would not apply. So the Violence Against Women Act provides housing protections for survivors of domestic violence, sexual assault, dating violence, and stalking who are applying for or living in federally assisted housing. Again, has to be federally assisted housing involved. VAWA applies to a survivor regardless of someone's sex, gender identity, sexual orientation, disability, or age. That's really important to remember because the title of the law, right, the Violence Against Women Act, can be really misleading. Because of the title, many people believe that only women are protected by this statute, and that's not true. The Violence Against Women Act housing protections applies to men, people who are transgender, and other folks who have other kinds of identities. As long as you're a survivor, you're protected by the Violence Against Women Act. And again, VAWA only applies in situations when there's a federal housing subsidy, not when it's just pure market rental housing and there's no subsidy involved. Next slide. So what are the survivors' rights under VAWA? There are many, many rights, and there's a lot of detail under all those rights, but today we're just going to focus on a high-level overview, and if folks have more questions, please feel free to follow up with us. But generally speaking, survivors cannot be denied admission, they cannot be evicted, nor can they have their assistance terminated because of the violence committed against them. All tenants and program participants, so not just folks who are survivors, but anyone who is a tenant in the federal housing program, anyone who's receiving assistance as a program participant, they all must receive a notice that tells them about their housing rights under VAWA. A survivor can request that an abuser or perpetrator be removed from the lease or the housing unit if because of the acts of violence. Sometimes that's called a lease bifurcation, but if there's not a lease involved, it's not necessarily called a lease bifurcation. But you may have heard that term lease bifurcation, and that essentially is what this is. It's a request to get someone off the lease or housing contract because of the violence that's been committed in the household. Survivors who have a housing choice voucher, or colloquially, housing choice voucher is often called Section 8 assistance. So survivors who have Section 8 assistance, they can actually take their voucher and move with the voucher. If they don't feel safe living in their current unit, they have the ability under VAWA to say, well, I want to take my voucher and live in a totally different city. The city could even be out of state, so long as the housing authority there will take the voucher assistance. And I want to use that assistance in this other unit that's far away, and that's okay too. Next slide, please. Survivors can also seek an emergency transfer to another unit in the same program or to a unit under another federally subsidized housing program. So again, if a survivor needs a safety move, a survivor has the ability to request for an emergency transfer and also receive the transfer. We'll talk about that a little bit more when we get into our scenario related to Taylor, where it's pretty clear that Taylor needs an emergency transfer. Survivors also have the right to stay in the unit if they feel safe staying in the unit, even if there's been criminal activity that has taken place that's directly related to domestic violence, sexual assault, etc. So if a survivor feels safe living in the unit, a landlord or an owner can't say, well, you have to get out. You have to get out of the unit because of all the trouble that you caused and you have to leave. We're going to evict you. That is not permitted under the Violence Against Women Act, and also fair housing laws as well, but certainly under VAWA, that's not permitted. Survivors also have a right to strict confidentiality of their information. So any information about their status as a survivor that they share with the landlord as part of asserting their VAWA rights, all of that information is strictly confidential under VAWA. And a survivor, as part of providing proof to a landlord, they have the right to self-certify or use a HUD form that is a self-certification form. And I provided the number here just in case so that you all have that reference. But it's HUD form 5382. It's a self-certification form that survivors use to provide proof that they can provide themselves to the landlord about their status as a survivor. And the only situation where a landlord can ask for more documentation. So if a survivor, so say there's a survivor that wants to assert their VAWA rights, they go to the landlord and the landlord says, okay, but you have to provide some proof. The survivor gets to choose what kind of documentation to use. If the survivor says, the safest way for me to do this is for me to use this HUD form, this HUD self-certification form, then they fill out that form, give it to the landlord, and that's it. The landlord does not get to say, I need more. I need a protective order. I need a police report. I need something else. I need something from whatever advocate you're working with. We need third-party documentation. this landlord is not allowed to do that unless there is some kind of conflicting information. So if there is conflicting information, meaning that there are multiple people in the household that is filling out this self-certification form and saying that they're the bad person, I'm the good person. But otherwise, if there's no conflicting information, a provider cannot ask for additional documentation. Next slide, please. So like I said before, VAWA only applies in situations where there's some kind of federal housing subsidy involved. I mentioned a couple of examples like public housing, Section 8. Here's actually the full list. I'm not going to go over it with you just because it is an extensive list and y'all can obviously just go back to this chart for reference. But just know that, again, only federal housing programs are covered by VAWA, but that's not true for the Fair Housing Act's protections. Next slide. Okay. So along with the federal laws that we talked about, and I understand we're going very quickly and I apologize. So if you have any questions, I'll try to answer them during our Q&A or one-on-one. We talked about the Fair Housing Act, which is a federal law. The Violence Against Women Act is another federal law. Really important to keep in mind is that there are a whole host of state and local housing protections that exist. These state and local housing protections are critical for survivors because they actually provide more protections than the federal laws do. And a lot of times those protections are nuanced enough that the protections are really, really crucial to making sure that survivors are safe and that they can get to alternative housing as quickly as possible. Some of these state and local protections explicitly extend to other categories of survivors other than domestic violence, like sexual assault, stalking, dating violence, and human trafficking survivors, but not all of them do. So you're really going to want to look at the text of these state and local laws and see actually exactly what categories of survivors are covered and how they're defining these different categories of survivors, because sometimes they might say domestic violence, but the way that they're defining it actually includes sexual assault and folks facing trafficking. So that's also something that we're happy to help kind of walk you through in terms of like looking at the actual language of the laws. Next slide. Here's where I tried to kind of categorize the different kinds of laws that we're generally seeing across states and localities, just to give you a sense of, well, what are these state and local protections? What do they look like? What kind of protections do they provide? And so generally speaking, well, these numbers are a little bit out of date. They were up to date as of 2017, but since then, fortunately, many other states and localities have created new protections for survivors. But generally speaking, half the states, more than half the states have early lease termination provisions for survivors, where survivors can get out of their leases if they don't feel safe with no penalty involved. There are quite a few states with lock change laws where for survivors who want to stay in their current unit, they have the ability to request for a lock change from the landlord. There's also some other jurisdictions that have protections for survivors who call 911, who seek police assistance, and that there is a prohibition against them being penalized for calling the police multiple times. And there's also other protections for survivors against housing discrimination and eviction defense protections that they have that are really critical for survivors. And for more information, please go to the National Housing Law Project's website, which is down there. They actually have a publication called the Compendium, a state and local law compendium, where they've compiled all of these laws together. And they're actually about to, I think, publish the newest version soon. Next slide. Okay, since we're talking about protections, I did want to talk about a little bit about the COVID-19 eviction protections. This is such a big issue. We've heard all of the stuff in the news about the eviction moratorium. It's in effect, it's not in effect, it's being challenged in the courts. Is it in effect? What exactly is going on? There is a federal eviction moratorium right now. It was effective as of August 3rd. So this CDC eviction moratorium prevents renters in communities experiencing a substantial or high level of community transmission of COVID-19 from being evicted for non-payment of rent. So this moratorium is different. It's narrower, right, than the former eviction moratorium that was more general. It didn't require that the tenant be in a community experiencing a high level of community transmission of COVID, but this one is different. This one is much more narrow. You have to be in a community that is experiencing a high level of transmission. To find out whether or not you are in such a county, you have to go to this website to figure out if you're in a county that would be covered. The moratorium protects renters for up to 2 months And the period of time that we're talking about is August 3rd to October 3rd. And then renters, unfortunately, do lose protections under the moratorium once their community is no longer experiencing a high level of community transmission of COVID. Now, I know that raises a lot of issues, right? Kind of like, well, what if one day they are and then the next week they're not? What does that mean? When does the coverage start and end? I totally get that. And so those are really fact specific and nuanced questions. So if you have any kind of concerns about that related to a specific situation that you're facing, please contact me. Next slide. Okay, the moratorium also requires renters to provide to their landlord a signed declaration form that's completed in order for them to be covered. Renters who previously submitted declaration forms are not required to do so again. So you might be working with folks who previously under the former eviction moratorium already completed and signed one of those declarations. If so, they're fine, they're covered. They don't have to complete a brand new form. But if they did not do that, and they've never completed such a form, you do have to go to the form, download it, complete it, and then submit it to the landlord in order to be covered by the current eviction moratorium. As a reminder, the eviction moratorium does not relieve renters from their obligation to pay rent. There's still a responsibility that the tenants have to pay rent, and whatever rent they do not pay off, it does accrue as time goes by. So really important. So if they can pay any amount of it, to please go ahead and do that. If you want to learn more about the CDC eviction moratorium, please go ahead and look at this resource that it comes out of the National Low Income Housing Coalition. They're a fabulous organization that has been providing a lot of advocacy around protecting tenants during this really difficult time. And then on the state and local level, there are also eviction and utility shutoff moratoriums. So there are a couple, there aren't that many right now that go through until the end of September. And those state and local moratoriums provide slightly more protections than the federal ones. So go ahead and look at that to see maybe if your state and locality has an additional moratorium that provides an additional layer of protection. Next slide. And if you are a renter or if you are a landlord or a property manager that wants more information about the emergency rental and utility assistance programs, there's a lot of assistance right now, especially a lot that came through the American Rescue Plan that was passed, that was enacted into law, I believe in March or so. Please go into these websites. The Consumer Financial Protection Bureau now has a website where you can access the rental assistance programs. And then the Low Income Housing Coalition also has a tracker. And then you can also call 211 if in your locality you have a 211 that can also help connect you to different resources. Next slide. Okay, so we're going to go ahead and jump into a scenario involving Taylor. And so next slide, please. I'm going to read the fact scenario to you, and then there's a question. So if y'all can just type in yes, no, or I don't know into the chat box, that would be really helpful. So we have Taylor here, who is scared for their safety because their girlfriend living in a permanent supportive housing unit has been threatening them. We are the organization that provides a permanent supportive housing, and Taylor's girlfriend is the head of household. So the question for you is, do you think that Taylor is eligible for an emergency transfer? You can say yes or no, or I don't know. Okay, we have a couple of people who said yes, one person who said no. Okay, so most of us have said yes. So let's see what the answer is. The answer is yes. We are going to assume for purposes, I should have clarified this. We should assume that the permanent supportive housing is subsidized by HUD. And because it's getting a federal subsidy, it is covered by the Violence Against Women Act. It sounds like perhaps in this situation that there is some kind of domestic violence going on. We don't know totally based on the facts, but probably there's some kind of intimate partner violence happening. And if so, even if it's just threats, right, that is still part of domestic violence and intimate partner violence, then they would be covered. And so if Taylor is scared for their safety because of reasons related to the violence, then yes, they would be eligible for an emergency transfer. And the next question that we have for you is, do you think that the organization can terminate the assistance to Taylor's girlfriend, the person who caused harm? And remember that girlfriend is the head of household. Taylor's not, the girlfriend is. So what do you think? Yes, no, or maybe? Okay. Okay, it looks like we have a mix. It's pretty 50-50, yes and no. Okay, all right, so let's take a look at the answer. So the answer is no. The answer is no to, do you have to terminate the assistance? This is one of the areas where there's a lot of gray. This answer is not in the VAWA statute. It's not directly answered by HUD guidance related to VAWA implementation. And so it's really, really up to the local programs as to whether or not, on a fact specific basis, whether or not to terminate assistance. And so there's a lot of actually these kinds of issues and questions that come up when you actually go to implement the Violence Against Women Act protections. And Christina is going to talk a lot about sort of what she has seen locally in Los Angeles and how they've dealt with a lot of these sort of gray areas. But the answer here is no. The organization can determine whether to terminate the assistance for the girlfriend. The violence would be a grounds to remove the girlfriend, but the organization is not required to do so. And they can actually decide that, maybe we'll just provide alternative assistance to them where they're separated and they can just sort of live separately, and we can still provide assistance because we want to make sure that the girlfriend is also not homeless. So it's highly discretionary. So on that note, we can go to the next slide. I'm going to turn it over to Christina, who I work with very closely. I love Christina on a lot of issues related to the implementation of VAWA, especially in a continuum of care. And she's going to raise a lot of the issues around sort of what they've seen locally and how they really employed best practices to really created and employed best practices to really serve survivors to the best of the ability of that they could. Christina?
Thanks, Carlo. Thank you for that warm introduction. And just to circle back to the previous scenario, one of the reasons why our continuum decided not to evict the abusive partner in the situation from housing is because we don't want to cause homelessness. We also don't want to give the abusive partner I shouldn't say ammunition because that sounds very violent, but the ability to blame the survivor for their becoming homelessness. I think in the instances where the perpetrator has been removed, they've been placed elsewhere, and they've been provided with the support that they need to continue on their journey to permanent housing. And so far, that has been working. Next slide, please. So just to talk a little bit about the Violence Against Women Act policy in Los Angeles. We tried to make it as comprehensive as possible, which means that we also baked in some of the California laws that protect survivors. So in our policy that essentially rules all the COC programs, there is language and guidance around early lease termination. That way, the permanent supportive housing, rapid rehousing programs know that that is something that survivors have the right to. Included lock changes, including language around ensuring that programs aren't moving or evicting survivors without their consent simply because they experienced violence. And similarly, we also wrote in that a survivor cannot be removed simply because they call law enforcement to ask for help. I do want to briefly mention in Los Angeles, our community came together and decided that we just did not want to limit the housing protections to the federally subsidized programs. So we extended VAWA protections to all permanent housing programs, regardless of the specific funding source. To take it a little bit further, we also ended up extending the protections to all our interim housing programs. Because that's something that we had seen very often. And we figured if we can help people, why not? So we tried to make our policy as comprehensive as possible to ensure that survivors are safe, regardless of what stage they are in their journey to permanent housing. Next slide, please. We also extended some of the protections that VAWA has. I think VAWA sets the parameters for like the bare minimum, the baseline. But here we decided to extend some of those protections further. Just as a quick example, we use the California definition of domestic violence, which does include roommates. So roommates are also protected under VAWA. The federal VAWA language excludes survivors of human trafficking. However, we do have a lot of survivors of trafficking who are receiving services and PSH and interim housing and rapid rehousing, and we wanted to ensure that they also had the ability to request an emergency transfer in the instance that they felt unsafe. And then we extended the time that a survivor had to establish eligibility in the instance that the qualifying partner ended up being the partner that was causing harm, or if the survivor needed to be moved to a different location, but they weren't quite ready for. So just to give you like a little bit of a tangible example, we had a program. I was working with a household in interim housing, and the survivor requested a transfer. And instead of waiting around for another interim housing bed, the program was able to connect the survivor directly to rapid rehousing. Even though the survivor wasn't quite ready to make that move, at least not according to our eligibility guidelines, but we were able to maneuver that way, again, just to ensure quick and safe connection to housing. Actually, most recently, and I will briefly speak about this because I'm very excited, but we don't have as much information yet. Our Coordinated Entry System Policy Council, essentially the body of community stakeholders who create the policies that our coordinated entry system abides by, also passed a transfer policy for permanent housing resources that specifically focus on, well, not specifically focus, but that also include other crimes that are not necessarily covered by VAWA. So as you all know, VAWA covers survivors of or domestic violence, dating violence, stalking, sexual assault. Locally, we added the human trafficking, but our survivors sometimes experience harassment from neighbors, or sometimes, you know, their places might get robbed and they might not feel secure. So our local body decided to ensure that those folks also had access to safety. Like I said, we don't quite know what it's going to look like practically. I believe this was passed last month, but we're really excited that we're trying to be very intentional about ensuring that folks feel safe locally. Next slide, please. And like I mentioned earlier, our VAWA policy extends beyond some of these, or not some of these, but beyond federally subsidized permanent housing programs. And covers all of our housing programs. And we are training everybody from program staff, landlords and property managers. And we're also speaking to and with our public housing authorities. We all have, you know, the same kinds of parameters that we have to abide by, and it's been a wonderful opportunity to collaborate with them, to share best practices, and to try to streamline the processes. Because I think if somebody is in danger and is in crisis, it might be difficult for them to like sort through all the paperwork and, you know, the HUD 5382 document. So we're trying to collectively lower the barriers so that folks can easily reach out and ask for help. Next slide, please. So we actually, after writing the policy and creating the interim emergency transfer plan, and I will say it's interim because it was in response to the needs that COVID brought to our community. We are still working on a longer term, more robust plan. We launched a website because we want to be as transparent as possible and make information as easily accessible as possible. So we created a website that houses everything related to the emergency housing vouchers, to the emergency transfers, and created this little chart that guides a survivor through how to navigate a transfer. So aside from creating a website, we also created a very specific email account. That way, survivors who have access to email can email us to request a transfer. Similarly, we also have a phone number where survivors can call at any time to ask for a transfer. Although I will say the phone number and phone line are not just meant for survivors. We also get calls from providers and property managers who are assisting a survivor in a transfer, but might need a little bit of more support or a little bit more guidance. But the overall gist is that a survivor can make a verbal request to initiate a transfer. Another thing that we wanted to do, again, just to lower the barriers, is to not require any type of documentation. Survivors do have the option of submitting a written request if they want, but they don't need to. All a survivor needs to do is say, hey, I don't feel safe, I need a transfer. They can either start the process with their case managers, Or if they don't have a case manager, or if they don't feel safe with their case manager, or if they just don't know who that person is, they can reach out to LAHSA directly. At that point, either the case manager will work with their team to identify a comparable unit within that program's portfolio. If that is not, or if that takes a little bit longer, or if there's nothing immediately available, then the covered program would call us. We will work with our, we call them countywide matchers, who have an eagle's eye view of all the resources that are out there. So we work with them to identify a comparable unit in a location that feels safe for the survivor. Similarly, if the survivor contacts LAHSA directly, then we'll work with the housing provider as well as the specific matchers in order to, again, identify a safe unit for that participant. Next slide, please. This is just a very wordy slide as to what I just explained, but the gist is there. Essentially, it's just a collaborative approach that we take in order to assist survivors find housing. I will say the phone number and email have been great when it comes to survivors who are housed, who know they're in a subsidized unit, but don't know where to go. We've gotten several calls from survivors who might be receiving a Section 8 voucher from one of the, I think, 14 housing authorities located within the Los Angeles County, and we're able to connect them that way. We're also able to advocate for some survivors who might be living in a program where the property managers don't know that they have to abide by VAWA. So it has been a great opportunity to ensure that not just the agencies funded by LAHSA know about VAWA, but that we're also collaborating with the rest of the housing providers that are within our communities to ensure that we're all on the same page as to how to support survivors. Next slide, please. And if y'all want, I will drop a link to our website in the chat. But again, we tried to make everything as easily accessible as possible. And from a frame of equity, also translated all the documents into the 10 different languages that are most common in Los Angeles. You can click on, well, you can't right now, but let's pretend. If you click on the Learn More under DV resources, it'll give you a list of the different languages that are available for that specific document. This was for, even though it says survivors, anybody can use it. Next slide, please. And then this specific chunk of our webpage is for providers. That way they also have access to the information. We actually went ahead and also made brochures and posters so that they can print them themselves and hand them out to their participants along with the required HUD documentation, just because we figured it's a little bit more digestible, it's a little bit easier to understand, and it's more clear as to how they can ask for a transfer within our continuum. So this journey has been very fun and very exciting just to see how we can, increase survivor safety and access to transfers without necessarily having to abide by, well, not abide by, but meet the VAWA requirements and do more. So far, everybody seems very excited, but we'll see what is to come. Right. Suzanne, I see you talking, but you're on mute.
Thank you. Thank you so much, Christina and Carlo. This was fabulous. I wanted folks to know I saw so many questions going on in the chat. We will answer as many questions as we can in the chat and also reserve some for the Q&A at the end of the session. And you can always reach out to our presenters. So, Christina and Carlo provided sort of the high level laws and Christina's perspective, best practice, and bringing those laws into policy in your program. And now I want to turn to what it looks like in practice with property management. First, I want to introduce Brenda again from New Destiny. Brenda, using the scenario that Carlo and Christina talked about with Taylor, I'd love for you to share how a property manager can use a trauma-informed approach to collaborate with programs and services to implement VAWA protections and support survivors in this scenario, and also from your experience in your program.
Sure, thanks, Suzanne. So first, it's really amazing to hear what LA is doing, and it's fantastic. And I definitely will be looking at those resources to see what we can do in New York. That being said, I think that there often is a disconnect between property management and what VAWA protections are. So I'm going to go hyper local, specific to New Destiny buildings. And what we do is we do have on-site services and staff who support tenants and who are also intimately involved with property management. And so they serve as sort of that bridge between what property management would normally do, and then also through the lens of trauma and how to provide care that reflects the principles of trauma-informed care. Specific to VAWA, I think, frankly, in New York, it's not very well understood. And I think the implementation of it has more variance than I would prefer. So I think for us, our first thing is making sure that our property management company is fully aware of all of the protections. And also more than that, though, it's important for us as well to go beyond what's legally required of us. I'll give you an example. I think we all know that the last year and a half has been incredibly difficult for many, many families, and many people have fallen behind on rent. And that is the case with quite a few New Destiny tenants. There is the emergency rental assistance program, and I think I take no pride in admitting that New York has struggled to get those dollars out of the door. But our staff on site have worked intimately, outreached, and supported tenants in applying for the type of funding. But the additional layer to property management is we also instructed our property management company and said, anyone that is working with us and has submitted a application for these funds, don't put them in legal. Because that does nothing but layer on additional stress that no one needs right now. And I think for us, there was a little bit of pushback from our property management company because they said, well, if you don't do this now, then you're going to start that clock much later down the pike when more people are already in the pipeline. And I think we really felt like it was important for the emotional well-being of our tenants and just the overall sense of community to not layer on any additional stress in what is an incredibly stressful time for all of us. I think another way that we can look and approach property management in a really trauma-informed way is we have survivors who have had really difficult experiences, and because of that, they require service in a way that might not be what we would normally provide. For instance, we have some tenants for whom they have a very difficult time allowing a male site property management maintenance staff into their homes, especially if they're by themselves. And normally and frankly, most maintenance staff are men. And so how do you accommodate that? So for us, knowing when that is the case, we will do our best to schedule somebody from the social service team or somebody else that they trust to be on site at the same time while the work is being done. And I think the general intention is to meet our tenants where they're at and where their service needs are. I think also something else that we've done very similarly when we built community where other tenants have identified like there's something going on in this home and you might want to know about it. And so we reach out, we don't identify which tenant flagged the issue, but what we're trying to do is head off a bigger problem before it grows to a point where maybe there's law enforcement involved. And I think for us, it's building the amount of trust between our social service staff and our on-site property management staff, and just having a dialogue that's less about who's at fault or who's right or wrong. It's really more about how do we move past this? How do we fix this? So I think that is how we would normally approach property management. And I think I do want to also flag that it is a delicate balance, and it is definitely it often can feel like a high wire act, because on one hand, you do want to maintain a safe environment for the entire building, but at the same time, we exist specifically because we know that survivors need assistance and permanent supportive housing.
Thank you so much, Brenda, for that really comprehensive response and chock full of examples on how, you know, with those values and principles of meeting tenants where they are and building trust and collaboration. And then the high wire act piece certainly is a great kind of image and analogy for, you know, the work that property managers do every day. And so now we want to direct this question to both you and Sharik. So wondered if you could share with us a story about how you experienced tenant-centered collaboration. So continuing that theme of collaboration between property management and services staff. And then we have a couple other, you know, sub questions about like what practices or models really characterize that success, and then what didn't work and why.
That's fantastic. So I actually think that I would like to pass it over to Sharik first, so she can talk a little bit about her experience as a tenant of one of New Destiny's buildings.
Hi again. Well, as a tenant at New Destiny, I came into New Destiny in the pits of COVID. It was about 3 years I was looking for an apartment. It took me a while because I was in a DV shelter, tier 2 DV shelter, from an emergency shelter to a DV shelter. But I think my son at that time, because I have a little boy, he was at about 9 months when I came into the shelter system. And then when we came out, he was 3 going on 4. So it was a long time struggling to find an apartment. And I got connected with New Destiny because I sent an application, my case manager at the time. We sent in the application to New Destiny and different places. New Destiny get called, and I get to meet with the property management. I had a Fairhead voucher, which taking so long for you to get an apartment through Fairhead voucher. You're gonna be discriminated. But I end up getting called, and they changed my voucher, relinquished my voucher to a Section 8 voucher to the property management. And I did get through when I did apply for the Section 8 voucher, so I got into the apartment here at the New Destiny. And when I came here, it was, yes, COVID. It was January 23rd, 2020. I moved into this apartment. And then by time June 19, I got a flood. It was kind of, it was like a mental strain. I was so depressed and so, okay, I just got here, and then something big, all my stuff got damaged. But when I came here, I spoke to the on-site person who's on site here, the tenant support coordinator. She ensured that she helped me to make sure I know my safety. I know how to budget. I know how to do everything. And she once said, you need to get renter's insurance, but I didn't take it as serious. So, but when I got the flood, then I realized what's the real need for the renter's insurance once you're in an apartment. It was kind of a struggle for me, uphill battle, because I struggled with, I had a surgery, I had things, but the tenant supports coordinator was there for me. So it was really good to have somebody on site that actually help you, even to help the community within the building, because I met few other tenants because of the tenant coordinator. So that's how I actually built a little community within the building. And she was very she was very helpful, because she still is helpful. She helped ease some of my stress. Even a super in the building helped ease some of the stress and the problem that I would go encounter with the flooding. He ensured that I was keep up to brace with the apartment repairs. He make sure that I had a other unit to go into when the flooding happened, because they didn't know exactly where I would go, if I was go outside to a hotel. But they from the apartment here, they fixed it up nicely, like if I was gonna move into the apartment, and they make sure I had it clean and nice and ready for me to move until my apartment was finished. So there was good assistance on the behalf of the tenant coordinator here, support coordinator here. It was really, to be honest, it was really a relief. It was a little stressful for me here, for moving in on my own from apartment, from being with somebody in sharing a apartment with somebody, to get in your own apartment, your permanent housing, but got into a problem while they were here. So, and then having somebody here to help you navigate the system, to tell you how to reapply, to recertify, to make sure keep up to date with your rent. And it good to have, it was really good to have somebody there who supported you and help you to build community. Knowing how I was a person, everybody used to say, Sharik, you need to build community. And came in here and I start building a community, because I'm not really from New York. I don't know much people here. Don't have much family, but then coming here and having their sister, even a person who could counsel me when I'm sad or when I'm down, when I'm going through a lot. It was really good to have that support within while I was here. And even though when I was in the hospital, I actually get them to help me. She went all the way to ensure that I had food here, that I have food, I had what I need, because it was COVID time, and they weren't even here on site. They were talking to me through phone calls. So it was really good, and really a really important part of New Destiny. The New Destiny experience, I just call it.
We're gonna have to trademark that, Sherry.
Yes, your coordinator and the super really good at this site where I am.
Well, thank you, Sharik. I just want to echo that, being intimately involved of when the flood happened, literally our first thought was like, oh God, what are we going to do with Sharik? It seemed like a terrible idea to try to move her and her child into a hotel, just everything we didn't know about COVID at that point. And so really core and central to the programming is community building. And to Sharik's point, she did form relationships even from January until June. And for several nights, one of her neighbors opened her door and her friends and let her stay there while we fixed up the vacant apartment to make sure that she could stay there until her apartment was fully renovated. And yes, we always advocate for renter insurance. We also realize that realistically, that's not always feasible for folks. So while we do recommend it, we also realize that at times that's out of reach. And so when some of Sharik's things were damaged, we couldn't replace everything, but we did try our best to replace some of the more critical things in her household. And so I think the core piece of that is trying to support our tenants where they're at and with whatever emerging needs that they have. I feel like we try to be a jack of all trades. And I think that that's come through an evolution of a variety of things. So I think I've been with New Destiny for about 3.5 years. And prior to that, my understanding is the organization has evolved and gone through many iterations on how to do property management. We've done in-house property management, we've done back office property management, and now we have full service property management. And the difference here is for us, in-house wasn't the most effective because of the size of our portfolio. There's so much compliance involved in property management that you really need a staff of a certain size to be able to make sure you're in compliance. And the reality is we didn't have a portfolio big enough to support that kind of staffing. And so we tried back office and that helped, but we realized that it needed a little more attention. And so now we have full service. But I do want to note that even for full service property management, which is essentially a professional property management organization manages our properties, my recommendation is if you are the owner of the building, you should still be very intimately involved. Not to the day-to-day recertifications necessarily, but we make a point to go out to the sites regularly just to make sure the buildings are maintained to New Destiny standards. We often, I hear from all of our staff if there's any issues with property management from our social service team. So there has to be some kind of senior level liaising between the organization and the property management company. And I think ultimately what's really helpful, and throughout my career, I think it's natural that I think property management and social services tends to the relationship can be very tense. And I think ultimately it's because they've been tasked with different things. So it's important for that bridge to be built. And so people understand that the end goal is filled units and having people be able to live there safely and having a strong community there. That benefits all of us. And so making sure that connection is made is really a key point. And also keeping your finger on the pulse of how things are going is also incredibly important. I think that answers most of the questions, Saba. If not, please let me know if I missed anything.
No, that was really beautiful. Thank you so much to the both of you, Sharik and Brenda. Sharik, thank you for sharing with us your story, which, was in the context of COVID, even more of a lot to navigate. And so I really appreciate your sharing, how community was part of your experience, the community of the New Destiny community and your neighbors, and how the coordination was really quite effective in getting you into a new unit. I'm so happy to hear that, how smoothly that all went, and I just commend the team. And just, so I learned so much from what you shared. And then Brenda too, like just these themes around being intimately involved, being coordinated, and understanding that everyone on a supportive housing team has different goals, but that we all will have like this, just building that shared end goal and vision. So that's really terrific. And I think right now we're kind of headed toward our Q&A section. I know we have we got a lot of questions about VAWA, but I really want to invite the audience to ask any other questions to do with especially property management and coordination of all the elements, all the sort of participants in a supportive housing environment. And we kind of had a back pocket question. So maybe I'll jump into one of those and invite anyone on the panel actually to address it. There's an overarching theme, of course, to the toolkit, and I think to each one of these webinars about how we can practice trauma-informed care. And often supportive services, property managers, and developers in affordable housing have a lot of struggles with just the act of doing the work. And so this piece around, building a trauma-informed culture is good for everyone involved, including, of course, centering, of course, the experiences of tenants. And I wondered maybe to hear from, since it's me and you right now, Brenda, to hear from you first in terms of what practices do you have, like on, what practices can you share? And again, anyone else can chime in after too, around like fostering that sense of collaboration, which I know we heard about earlier at the very beginning of the presentation, that is trauma informed, and fostering that among property management, direct services, and maintenance staff. And in any of the work that any of our panelists are doing, but we'll start with Brenda.
Sure. I think, when I first started here and they were talking about trauma-informed care, and I'm familiar with it as a social worker, and there was like, everyone was like, well, the maintenance staff need to be trauma-informed. And I thought to myself, that seems like a heavier lift. Than, I think most of my our maintenance guys are great, but not exactly guys who walk around or speak with kid gloves. And so I think the perspective of just approaching it from mutual respect, that this is like anybody else, you have to be able to be respectful of each other, and that disrespect is not tolerated. I think the other part of that is really getting a firm footing. So usually when we're filling vacancies, we're meeting with folks to make sure that this is an appropriate setting for them, that this is where they want to be. And we are very upfront, like, this is the services, these are the people who are in the building, they're going to say hi to you. So really starting off with sharing how the building operates and who is in the building. And then within the first week of move-in, we've asked staff to make contact. Like contact, we're not we know everybody, when you're moving, the first week, you really don't want anybody bothering you and asking you a ton of questions. But we ask that our staff introduce themselves and also the maintenance people. So they can start off the relationship on a very neutral territory. And then also just offering things like, if you ever need any help, we're right here. And so taking some time to build those relationships, I think it's really important to recognize that this is permanent supportive housing, which is different. I think folks who work in shelter have quite a tough road, because they're very time sensitive and they have an end goal that's very specific. And sometimes you're not able, I do think that people employ trauma-informed practices, but it can be very difficult. Whereas we have a little more time and runway to build that relationship and kind of work through and understand that particular tenant's experience, so that that you can tailor how you approach them and how do you work with them, versus it's just not a one-size-fits-all perspective.
Yeah, I just love that foundation of relationship building and the opportunity that maybe we have in supportive housing to really do that with intention and take our time, whereas it's not always possible with other housing interventions. Did anyone else want to chime in before we go into our Q&A? Thank you for that, Brenda.
Sure.
Okay, so I have been trying to compile a list. I know that Carlo has just been amazing answering some of the questions that you had. And so I have a list of questions, but I haven't necessarily curated around which one was answered. There was a question at the beginning around, I'll just read it. I worked with a transgender patient. Sorry for that. At one point, I tried assisting a client who's trans to flee her batterer all the DV shelters denied her for being trans. Does this act protect her from being denied?
Hey Saba, yeah, I saw that question and I haven't answered it yet because I was still sort of thinking about it. I mean, certainly,
Okay.
like I said, that, VAWA prohibits any kind of denial of assistance to housing that's covered by VAWA based on sexual orientation. But there are other laws that sort of more squarely address that, like the equal access rule under HUD. So I would say that VAWA is one of the laws that prohibit those kinds of acts, but there are other ones that sort of more squarely address that issue.
Excellent. Thank you so much. And so, Carlo, I'll just go to the next one and you can kind of tell me if you already addressed it. I'm not sure that you have, but I haven't been able to check that well. Any advice on how to advocate for someone who wants to use VAWA, who is in a project-based and they're not safe anywhere within that project-based program?
Yeah. I tried to address it in the chat.
you
With
did.
project-based units, yeah, it's okay. I can discuss it a little bit, because the challenges do vary based on exactly what kind of housing program the survivor is already in or is trying to access. And sort of what federal agency that falls into is also a sort of part of the equation too. But if, say, like you're not dealing with housing choice voucher, where essentially the survivor would be porting with the voucher, so taking the assistance and moving, or even in public housing where it is quote unquote project based, but there are other public housing units available where the survivor could move to. I think probably the question more has to do with project-based assistance where the provider is a private provider. So it's like a private landlord that is not typically sort of in the game of providing affordable housing. And so the challenges that we've heard is that, survivors and their advocates go to these private landlords and they say, hey, they need a transfer. Is there another project-based unit that has the same subsidy that you could transfer them to? And they say, no, the only units we have are in the same building. You can't go to this other building because if you go to that other building, it's restricted by rules, et cetera, which is actually in large part why we created, like I mentioned in the chat just now, we have an advocacy flowchart for folks working in the low-income housing tax credit program, because those rules are so different from the HUD rules. And so we worked with someone from the industry, actually the housing industry, to create a flowchart to help advocates really speak in the language of landlords that are in that low-income housing tax credit business, to help them understand, like, we get what you're saying, but we're still trying to get a safety move for the survivor. So let's figure out how to find some common ground around this. And it's a similar thing with HUD too. Like, you need to be able to kind of talk their language to figure out, okay, what exactly is the world of possibilities? Because most, I would say, private housing providers that are not mission driven, they will say like, well, there's just not much available. And they're not kind of thinking more openly, like a lot of the providers on the call today, like they're great, right? They're mission driven. They work with survivors. They'll do whatever it takes to get what's right for survivors, but that's not always the situation. And so it's really good to sort of be able to be on the same space about, how to talk about these things.
That would be great to include that as that walkthrough as part of the resources that we send out to everyone on this call. So thank you for mentioning that resource, Carlo. Okay, I have another question. How do you deal with use of substances on property that have been criminalized locally or federally, recognizing that using substances of all kinds is a way that so many of us manage our trauma? Navigating this can create tension between social services and property management. How do you navigate this with your tenants and amongst and across your teams? Such a good question, and thank you. I see, Brenda, you came on camera.
Yeah, I think that is a tough question, right? Because I think the first thing to consider is the substance use affecting other tenants throughout the building? I think if someone is known to use substances that have been made illegal or have been deemed illegal, we do approach the tenant and offer assistance to seek other means of managing their trauma. But you're right. I think that oftentimes folks will make a personal decision, and they do have the right to do that. That being said, if their substance use is making the community and the other tenants, or it's impacting their tenancy, then I do think that is a tougher position to take, but will ultimately pursue other options. And we do say, like, listen, we want to work with you. It's not about jeopardizing your housing, but we do need to balance the protection of a safe environment for everyone in the building. But let's work through these series of options first. It's never the first option or second option or third option for New Destiny to make somebody housing unstable. And we do want to do our best to help them manage and also maintain their housing, but we will always have to work through the lens of balancing the safety of the entire community.
Yeah, that balance is, again, kind of that around that piece around the tension, and then how are we going to balance our shared goal along with like the different responsibilities. And
yeah, and I don't mean to interrupt you, Salva, but I also think I want to flag that, not sugarcoating or presenting a, rose-colored glasses lens of life in New Destiny housing, but we have some of our tenants who have seen that their neighbors are struggling. And in fact, they're the ones who have reached out, and they're not reaching out only to say, there are sometimes where neighbors are reaching out and like, what is going on in that apartment? But often we've had numerous instances where they're reaching out of concern and trying to make sure that we're aware so that we can help, and trying to offer their own assistance. So I think that it can take shape, a lot of different shapes, but the main thing is, have we done everything we can do to maintain a safe environment for everybody? And also, have we done everything we can do for the tenant who is using substances to manage their own trauma?
Thank you so much for that honest response. And Sharik, I see you on camera. Did you want to respond to that? Not to put you on the spot at all.
Well, what I would say, the tenant support coordinator, they do, and yes, the tenants in the buildings that I actually get to meet as friends, they do look out for each other. And I find that because there are so much group and activities that has been presented to us for us to get to know each other, to build community within the building from New Destiny, because they have a children coordinator also here that helps support our kids. And so we parents have to meet these parents get to meet each other through the groups that they do offer us each week. Although I haven't really went many, but their support is tremendous inside the Anderson. That's why I said the Anderson experience, the New Destiny experience, right?
Yeah, that was it.
Right, because once you're here, they ensure that you're okay, that you do have answer the door. You do have food, you do have everything that you need, that you're not down, your bills are paid, and everything like that. Yeah, it's mentally, it's okay. It's a place that keep you safe, and it's also mentally keep you. Answer it. And
you're doing great. It's like in this world of virtual, we have to parent and and work beyond camera.
Yes.
Whatever you need to do with that.
Okay. I thank you so much.
Wonderful.
Okay. Okay.
I'm happy we got to hear your son a little bit there in the background, an additional participant to this. But thank you, Sharik, for naming community and sharing about that parent group, which is available, and where you can kind of meet each other's kids. I just love to hear about different program designs, and really just want to thank everyone on the panel for just their experiences, the information, the resources that were provided, the stories. It was just such a wonderful, chock full of great things. And I just want to let the participants know that we will be following up with a bunch of resources that were mentioned, either mentioned today and additional ones outside of that. So with that, I will pass it back to Amy.
Thank you, Saba. I heard so many themes that are covered in the toolkit on how to create permanent supportive housing for survivors of domestic violence. We'll stick the link back in the chat for how to access the toolkit, but certainly I heard the importance of flexibility, both in policies and in money. Lots of questions related to, sure, maybe we have policies around transferring, but how do you pay for the new security deposits and the new rent and the higher cost of rent in a transfer? I heard a lot about going beyond what is legally required. And so I think spotlighting the work of Christina Cortez from the LA Homeless Services Authority and the VAWA Interim Emergency Transfer Policy is a great spotlight nationwide of how to go beyond what is legally required for the needs of our survivors. Certainly community, the beautiful examples of how New Destiny builds community, both with property management and with tenants. All topics that are addressed further in the toolkit. We're really excited. Downtown Women's Center, in partnership with National Alliance for Safe Housing and Corporation for Supportive Housing, to dig even deeper into the toolkit. This was the first of 4 webinar series. Thank you so much for joining us today. We're going to drop in the link, the flyer for the next topics that we'll cover, 1 a month. So we'll meet back at the end of September on the topic of intersectionality and racial equity for survivors in permanent supportive housing. Later on October 20th, we'll meet with a group of experts on trauma-informed care and architecture and operations design. And then later in November, we'll have a panel on strategic partnerships, what it takes to create permanent supportive housing with your property managers, your housing developers, et cetera, for domestic violence survivors. So thank you so much to our panelists. You were fantastic. And it's been a delight to work with you all. And we're just so thrilled that so many came in to attend today. And we wish you all the best. We hope that you can join our future webinar series as well. Take care.
Thanks, everyone.
Bye.